Hello, my name is Nicole Humbarger, and I'm a BSN senior nursing student at the University of St. Francis in Fort Wayne, Indiana. I'm doing a presentation on the clinical nurse specialist for nursing synthesis by Carla Mueller. A clinical nurse specialist is an advanced practice nurse who provides direct care to clients and participates in health education and research. A clinical nurse specialist are licensed RNs with a master's or doctorate degree in a specialized area of nursing. You obtain your certification through the American Nurses Credential Center. The clinical nurse specialist is considered an expert in their chosen field of specialty. They provide care that emphasizes in diagnosing and managing patients' bodily responses to specific health problems. The CNS role is very diverse and can vary based off of what the chosen expertise field is. The history of the clinical nurse specialist began back in 1923 when the need of nurses began to increase. Hospital structures began to change and the need for more educational practices towards nursing grew as well. The Goldmark Committee began to recognize that there was a need for a more specialized area of nursing. In 1947, the American Cancer Society recognized that oncology nursing was a specialty and developments toward advanced education became the focus. In 1954, Hildegard Paplau revised the nursing program and developed the first master's program in psychiatric nursing at Rutgers University. In 1963, nurse practitioners overcame the primary care provider shortage and the expansion of professional nurse traineeship programs began. In the 1970s, the ANA officially accepted the clinical nurse specialist role as an expert practitioner requiring a master's degree. In 1998, the National Association of Clinical Nurse Specialists issued a statement on the clinical nurse specialist practice and education role to distinguish among other practitioners' role. In January of 2005, the Oncology Nursing Certification Corporation began to offer role-specific advanced practice certification exams. The clinical nurse specialist has many different diverse roles. A CNS will provide clinical practice based off of their expertise in the desired specialty area of care. They will also provide counseling to patients on their health status and also the health care they are receiving. A clinical nurse specialist provides advanced teaching to their clients based off of their diagnosis and also educates other nurses and coworkers as they provide their knowledge to the community as well. A clinical nurse specialist can also have a management role by developing better health care and consult other nurse staff members into developing better aspects of health care. Research is another big part of the clinical nurse specialist role, as they participate in evidence-based practice and incorporate their learned knowledge into the workforce. The clinical nurse specialist has a very diverse role of specialization. A clinical nurse specialist can specialize in types of care, for example, rehabilitation or psychiatric nursing, and they also can specialize in specific populations, like the geriatric or pediatric population. They have the option of specializing in different types of healthcare problems, for example, pain or stress issues. They can specialize in different medical settings, including the ER or critical care, and they also can specialize in specific health diseases, like cardiac issues or renal problems. The salary of the clinical nurse specialist depends on the location and demand of the CNS's role. In the United States, a clinical nurse specialist can make anywhere between $74,545 to $88,168. The average pay of a clinical nurse specialist in the United States is $80,975. Right now in the Midwest, in Fort Wayne, Indiana, a clinical nurse specialist salary is ranging between $66,280 to $91,377. with an average amount of $71,000 to a little over $85,000 as a mean average. With healthcare reform in the market and the downside of the economy, there are many cuts in hospitals nationwide. Patients are wanting an increase in advanced nursing care that is reimbursable and a different form of receiving health care. This shows that there is an increase in the demand of the clinical nurse specialist. Patients' hospital stays are also decreasing in time, along with an increase in the patient-nurse ratio, which provides to be an increase in the advanced practice nursing. Clinical nurse specialist programs are seeing a decrease throughout the Midwest, though, but they still carry the majority of CNS programs. Currently, in the United States, the status of becoming a nurse practitioner is on the rise, with more and more programs offering only NP. In the United States alone, there are currently 272 clinical nurse specialist programs offered. In future trends of the clinical nurse specialist, we will see that the CNS will continue to grow in the near future. More and more patients are looking for an alternative method to receiving health care. A CNS's role will only continue to grow as our healthcare system continues to change. There is much confusion on the role of the clinical nurse specialist versus the nurse practitioner. Both the clinical nurse specialist and a nurse practitioner have previous registered of nursing license. They then have an advanced degree in nursing. Both the clinical nurse specialist and nurse practitioner spend time in providing care, education, and consultation to the patients that they see. The clinical nurse specialist and nurse practitioner provide a leadership role towards their patients and also towards their other healthcare members that they work with. Clinical nurse specialists and nurse practitioners are also very active in research, especially evidence-based practice, as they apply the knowledge they learn to their clients and also to the healthcare field. Both the clinical nurse specialist programs and the nurse practitioner programs focus on theoretical theories in nursing, regards to certain aspects of care, and also different ways of nursing. The differences noted between a clinical nurse specialist and a nurse practitioner are that the clinical nurse specialist is a more focused area of healthcare. Clinical nurse specialists are usually considered an expert in only one aspect of nursing, where they specialize, rather than a whole scope of a practice of nursing. Nurse practitioners, on the other hand, are usually carried in a broad primary care provider with a more open range of advanced nursing care. Therefore, they will not specialize in just one specific aspect of nursing care. They will receive patients on a more broad, open scope of nurse-patient care. The clinical nurse specialist provides a more advanced nursing care role with more direct patient care in a specific chosen field of interest. The clinical nurse specialist is seen as an expert in that chosen field and will serve as a preceptor to the registered nurses below them. Another positive aspect of the clinical nurse specialist is that they have more advanced nursing training, more research knowledge, and better leadership skills. Negative aspects of the clinical nurse specialist include a decrease in the clinical nurse specialist enrollment programs in the United States due to a rise in the nurse practitioner roles in graduate programs. There is confusion on the role difference between the clinical nurse specialist and the nurse practitioner. Also, there is a debate between the importance of the clinical nurse specialist role in healthcare. As you will see now, I have 2 slides of resources that I use to collect my information with